I'm the public health librarian. And yes, for nearly 20 years, before I was a librarian, I worked in healthcare in a hospital in kind of the financial services end of things. It was terrible. And it got really bad. So in a way, it was my all of our good fortunes that it got so bad, because it got so bad that I quit and said, what do I do with the rest of my life? So I became a librarian after some amount of pondering that question. And it's a pretty good gig. So we're gonna have a mix of a little show and tell from me and a little bit of hands-on work from you. And I understand that the folks here are not all UC Berkeley students, so that's okay, because we're going to, you know, I'm going to show you and talk about things that are not limited to UC Berkeley in terms of access. And apologies, I keep looking at my notes, so that's why you keep seeing the side of my head. So I just wanted to also take a moment to acknowledge that, that things in the world are wrong, that our, you know, our life at school and elsewhere is maybe not what we were hoping, expecting, and planning maybe a year or so ago. So, you know, we just keep on keeping on, I guess. And I'm glad to be here to help you all change the world, but no pressure there. Today, we're going to talk about, I'm going to introduce the literature review and what makes for a good search. So I'm going to talk mostly about the search process, a little bit of tips on databases like PubMed. This is a very handy skill for you to have in school, after school, whenever. Being able to successfully mine the scientific literature is one way you can show evidence that what you want to do or what you are doing works. It can support your program goals or whatever you might be doing. It can be useful if you have to deal with people like funders, for example. And one part of that skill is relating the research you find or what you're interested in kind of the greater body of scientific literature. So we'll talk about that. The research process, and when I talk about research, I mean this kind of research, delving into the literature. It's a process, it's not linear. You don't always go from A to B to C. There's a little bit of circling around. That being said, of course, often what you're doing has an end goal, like say a paper. So there is an end, and you can't spend forever searching, because you have to eventually, you know, read the stuff and then write your paper, right? But it is an iterative process, as we'll see in a little bit. And there's folks who can help you. This kind of research might be new or new-ish to you. That's fine. I'm around. Even if you're not a Berkeley student, you're welcome to contact me, and I'll make sure you have my contact info in a second. And then there's your mentors here. So you're not on it alone. So I'm going to probably go back and forth from sharing the screen. And so it's lovely seeing all your little rectangles, but I'm going to start sharing the screen now. Okay, this is not what you want to see. Here we go. So, and now I'm going to take all your lovely rectangles and make them like kind of tiny in the corner here. Okay, so I made a web guide for today's session. And here's the link to it. This is WCFBL, as in white coats for Black lives. Okay. So this will be up forever, and maybe someone can put this in the chat if that makes it easier. And this is me, and you're welcome to email me. And I think clicking this also will email me. So I'm around forever too, although maybe not forever. And here's a lovely dinosaur in the days when we were in person. Maybe you would be visiting me in my library, and this beautiful dinosaur is outside my office. So I love that I get to see a dinosaur every day. I miss it. So I'm going to work off of this web guide, though I'm not going to necessarily talk about or click on every single thing. If you have questions, there will be time at the end. You can put things in chat. You can make a noise and interrupt me, and that's all good. So I'm going to start scrolling in this guide. So what causes disease? You know, I eat a box of cupcakes every day for breakfast, and therefore I've got, diabetes all of a sudden, right? My poor food choices causes my problem. But there's always more. And you may have heard the term about going upstream. So we talk about that a lot in public health. What's upstream from my choice to eat cupcakes for breakfast? And I'm not going to read all of this, but there are various things around that can make it hard for a person to eat nutritionally. And so the point of that is not so much that you have to think of every conceivable reason for a thing you're researching, but you do want to kind of notice when you're reading articles, okay, what are they talking about and what's not there? So they may be talking about, oh yeah, when parents in the house smoke, the kids' asthma is worse. Okay, but what else is going on there? Do the parents have access to a way to stop smoking? Is there something about the house? They live in there's 3 people living in a single bedroom house. That makes it maybe worse than if, dad could go in the backyard to smoke. So there's always other issues to think about. Is your topic researchable? So I've put in 1, 2, 3 topics here, and you can kind of look at them and figure out which one of them is the most likely to get you a good research project. So when you're thinking of a topic to research, of course, you don't want it to be so broad that you're going to be overwhelmed by the amount of stuff you find. You search a database and there's 25,000 articles and you don't have time to read that. Similarly, you don't want your topic to be so narrow that there's nothing about it. And we'll talk a little bit more about broadening and narrowing scope. And then thinking about your question, okay, so basically research is addressing a question. What's the question that you want answered when you're doing research? And I've put on here some examples of questions about, a similar kind of topic. And how this can help you is when you're doing research and you're coming across articles, you're going to come across a lot of things that look kind of interesting. But you have to set it aside. You have to think, does this article help me answer my question? Yes, yay, I will use this article in my research. No, I'm going to set it aside because I don't have time to read every interesting article in the world. Maybe, I'll set it aside and maybe look at it later. So think about that when you're searching and evaluating what you find. And then similarly is the question that the articles address. So you're going to find a lot of articles that say, we did a thing and it works. Okay, we did this thing. We came up with a drug. We did this thing in a medical clinical setting. We did a public health intervention and it worked. And that's beautiful and lovely. It's not the same, though, as the best thing for addressing this issue is, or the best interventions are, or it's been shown that the best approach to this problem is. These are different questions. Just because something works doesn't mean it's the best thing. Structuring your search. So you can start by just putting words in the box, and that's kind of the Google way. We're all used to it. But it might also help to think about your topic in a kind of systematic way. And so there's kind of the what, who, when, where, why, how method. So like thinking about your question in these terms. There's another thing that's been around a long time that's called PICO, which started in clinical medicine, but it's moved on to public health. And basically, here's what the PICO stands for. But so you have like a population, like who are the people I'm concerned with? What is the thing I'm interested that's being done? And I'm comparing it to what? Maybe I'm comparing it to doing nothing, or maybe I'm comparing it to some other intervention. And then what's the outcome? So if you can put your question in these kind of frameworks, it can help you when you're doing the search for articles, because you're looking at an article and you're like, okay, does this article address some piece of my PICO or some piece of this? And that will help you with evaluating your article. Excuse me. Finally, I wanted to mention, or not finally, but finally on this page, you can hear the dog barking in the background. Isn't working from home different? Anyway, indexing. So what do I mean by indexing? So, are you interested in articles on labor? Or are you interested in articles on labor? Two things, same word, right? Do I want articles on delivering babies, or do I want articles on work? How do I tell my database which one I'm interested in? Or do I want articles on a thing that causes a disease? HIV causes AIDS. We say, and when we talk in common parlance, we might say HIV as if it's a disease, but it's not. And when you put HIV in PubMed, it thinks you want articles on a virus. So if I'm interested in a disease, I need to use a disease term. So indexing helps facilitate this process. And this is kind of the leap to a kind of higher plane of searching the literature. So databases like PubMed use indexing to describe articles. And this means that or in PubMed's case, nearly every article in the database is indexed with subject terms. In PubMed, they're called medical subject headings, or MESH. Understanding how these work can be very helpful to creating a search. But even if you don't want to take this leap and learn how to search with MESH, though I strongly recommend it, I think understanding the concept is useful because it gets you to think of your question in a precise way. So I'm interested in HIV prevention. Okay, what do I mean by HIV prevention? Do I mean preventing from getting a disease, or do I mean prevention from infection with a virus? There's a subtle difference that might be important in the research you're looking at in determining whether a given article is useful. And I just wanted to quickly show you PubMed's system of indexing called MESH. So I'm going to click on this link. But now I'm going to step back for a second. And I just wanted to make sure that folks who came on a little bit late, I'm working off of this web guide. Maybe someone's put it in the chat, which I can't see at the moment. And I also wanted to make sure, just in case there's anyone here who doesn't know what PubMed is. So PubMed is an article database. It's put out by NIH, National Library of Medicine. It's got tens of millions of citations in it. And it's usually the best first place to go for public health research. But right now I'm looking at PubMed's MESH, which is their subject terms. So if I put in a term like socioeconomic factors, we see a couple of things. One thing that we see is that MESH and these subject schemes tend to be hierarchical. So there's broader and narrower terms. And so I might think, oh, I'm interested in the socioeconomic factors and how they relate to whatever my topic is. And that's lovely. But if you can think of specific socioeconomic factors, like, are you looking at really all socioeconomic factors? Or maybe you're just looking at how income and poverty, say, affect something. So if that's the case, then you should use the terms that are relevant, income and poverty. And that will really help focus in on your topic, if you could build a search using the more narrower terms. And in PubMed, and generally this is the case with databases, the subject terms that are applied to a given article are supposed to be the most narrow terms that are relevant. So if the article is about poverty, it's going to get indexed with the term poverty, not socioeconomic factors, ideally. This indexing process is human mediated. So as anything human mediated, depending on my mood, I might like call it poverty or something else that day if I'm indexing the article. But that being said, using the indexing can help focus your search. So let me make sure I said everything I wanted to say about this. I think so. Okay, so I'm going to close this tab and I'm going to stop share for a second. So I just want to make sure that that made sense to folks. If anyone has any immediate questions or comments while I sit. Okay, all right, back to screen sharing. Okay, so we're back on our guide. So I hope everyone has their fingers ready because we're going to do a little work. So I'm going to click on this Find Articles tab. Here we go. So the nice thing about PubMed is that it's free to the world. And the link I have here is the free version of PubMed. Now, UC Berkeley and probably many other institutions that you may be affiliated with have their own version of PubMed that will provide links to online articles that you have access to through the institution. We're not going to worry about that today, but we're going to take a look at PubMed and do a little PubMed work. Here's my top tips for PubMed. We'll take a look at that a little bit. Well, as we do our exercise, some of these will come up. I have more links on PubMed here on the left. I also have a couple of other databases that are freely available for you to use. Google Scholar, maybe you're used to that. It's a very googly thing, but we won't go there today yet. So what I want you all to do is to open this PubMed exercise set. It's a Word document. So if you don't have Word, hopefully it will open up in something on your laptop or device. And so we're going to do an exercise here. So I've got it opened up here. So
Michael, could you send out in the chat the link to that? Because I don't know if people have it pulled up.
Okay, so the direct link to the exercise set.
And then you can access the chat if you like hover above. Yeah, thank you so much. Yeah.
Did I get that? Okay, so this will open up the Word document. Okay, so I'll give everyone a second to open it up, or more than a second. But it looks like this, and we're going to do exercise 1 together. So I'm going to give you about maybe like 7 minutes or so to do exercise 1. So it should be pretty self-explanatory. But if you get stuck on something, try to make a noise or do something that will get me to stop. But I'm going to go ahead and do it myself. So if you'd rather just watch, you're welcome to watch. So the first thing is to go to PubMed, which we can do by clicking this. And instead of typing, I'm going to copy and paste, which you can do too. And then the exercise gives you a little explanation of what you just did. The double quotes works in almost every database, including all the googly things and any other database you come across. Double quotes, it forces the database to search for the thing as a phrase, as exact phrase. So that can be very handy. If you didn't use quotes, it would search for the words like participatory and also research. You know, they could be anywhere in the record in PubMed. So forcing the phrase can be very handy. These tags like this is a PubMed thing that won't work in other databases, but nearly every database has a way to do something like this, usually with like a drop-down list next to the search box. Like, do I want to search everywhere, or do I just want to search the article title? Similarly, this truncation symbol also works in nearly every database that you'll come across, where you can put in a word stem and it will search for variants. Okay, back to PubMed. It says to click on the review box, checkbox. So now all we have are review articles. So it cut out like 95% of the articles. Review articles typically do not present original research, but it can be very handy to find a recent review article on your topic, because they kind of have scoped out what you might be doing. They have good reference lists at the end, and they can be, you know, kind of handy to see what other people think about what you might be doing. Okay, and I kind of mentioned that here. PubMed has other filters. Some of these are very handy, like age. You know, if I'm looking for studies on, say, you know, adolescents, I can check the little adolescent box and PubMed will only bring back articles that are on adolescents. Okay, number 4, we're going to change the display to abstract. And so that's nice because it's much easier to evaluate whether an article is useful if I can at least read the abstract. What else is next? Okay, scroll down till I see a mesh term below an article. I think the first one does not have it, but the second one does. And you click expand. So these are the subject terms that some person at PubMed applied to this article. And it's not unusual to see like this many, 15 or whatever this is, terms applied to an article. And as the exercise points out, the ones with the asterisk, these are like the most important concepts of this article. So if I like this article, I might want to build new searches using some of these starred terms. When you see a slash like this, the thing after the slash is called a mesh subheading, which basically is a way of modifying the term. So not just community health nursing, but the education of community health nurses. That's what this does. This modifies this. You can get into that in great detail in the later exercises in this exercise set, which we're not going to do. But what are we going to do? Click one of the terms and search for it in mesh database. So let's just click on this one. And this takes us back to, remember when we were looking at socioeconomic factors. Here's our term, here's the definition. If this definition matches my notion, then maybe this is a good term to use. Here's the hierarchy. A given term can be on more than one hierarchy. Let me go back to the exercise. Okay, that's the end of exercise 1. If you do exercises 2 through 5, you will be like PubMed experts. So this will be very handy for the rest of your life. I'm gonna briefly stop sharing, just see if anything popped up in the chat or if anyone has questions. Okay. What does a hierarchy mean? Okay, so in the subject terms, which are called mesh, these are, the scheme is hierarchical. So this term, community participation, shows up on this hierarchy. The lower terms are narrower, so they're more specific. They'll bring back fewer articles if I use this term in the search box. The broader terms will bring back more articles. So I look up a term and like, you know what, I'm interested in community health services. Let me just click on that and see what that does. So this is a broader term and it has its own narrower terms and it has quite a lot of them. And I'm like, oh, maybe this is too much. I want to go back to my original term, participation, and use that. So the subject scheme itself is hierarchical. Now, I want to say, so hopefully I answered your question. I want to say that hierarchy, which is very common that we encounter in the world, to me, that is a way of looking at the world. You could argue it's kind of a patriarchal even way of looking at the world, right? Everything has to fit in a hierarchy. Oh, good. I don't think that necessarily this is the only or best way to look at the world of research, but it's kind of what we see here. Oh, you know what? I was acting as if I was sharing the screen and I wasn't. Let me go back to sharing. Okay, so here's where I was before. So up the hierarchy, broader terms, down the hierarchy, narrower terms. If I click on a broader term, it's going to show me that term with all of its broader, all of its narrower terms underneath, which in this case, there's a ton. Okay. Okay, let me just, do we have time? No, we don't. Okay, so there's, I'm going back to our page here. There's another exercise here. I would strongly suggest you take, 8 minutes or whatever and do this. So what this means, pearl growing, I'll show you the exercise. This is when you're starting with a known good article. Okay, like I'm doing research on a topic and maybe I'm not getting anywhere, but I have this one article that's good. So what you can do, so here's the article that I found that's on my topic. So if you search for an article in PubMed, every article in PubMed, which we didn't go to yet. Yes, we did. Let me just hit back. Every article in PubMed has a similar articles link. So let's just click on one of these. Similar articles, see all similar articles. If I liked this one, maybe some of these similar articles are also good. So that's a quick and easy way to find more. And so I talk about that. Then I talk about going to using Mesh to maybe build a new search and so forth. And then you can go to Google Scholar. And one thing Google Scholar does is it shows you who has cited this article. So I can find newer articles that cite my article. And so this can be another handy way to find more. And it's called, building a pearl or growing a pearl because you're starting with one thing and you're building outwards to find more like it. So take a moment in your life with your infinite free time and do this pearl growing exercise. I have a bunch of search tips handouts on this page. I'm going to go ahead and click on this one, search tips. It talks about some of the things we've seen, like the truncation, child, it'll retrieve child, children, etc. The quotes, and so on. There's a few more. And then what I have here are some tips for if you found too many, some ideas to narrow your search. And then if you found too few, a few ideas to broaden your search. Because what I found is that when people start searching, that is a very common thing, is that, oh my gosh, I did PubMed and there's only 3 articles. There can't just be 3 articles on my topic. Or similarly, I do PubMed and I found 900 articles. And you know what? I don't have the time. I don't have time to look at 900 articles. So here's some ideas for making your PubMed search grow or shrink. Okay, let me close some of these open windows and go back to here. I have a few more handouts here. The workflow, the search is just part of the workflow. of writing a paper. And so I kind of have some ideas of how you might want to approach that workflow. One notion is to start by, when do I want to be done? When do I want to be done with all this? I have a finished project, whether it be a term paper or something like that, and work backwards in time. Like, okay, if it's due on X date, I'm going to give myself 2 weeks to write it, a week to do a rough draft, a week to do an outline, and that leaves me a week to do the searching. Because if you start searching, you're always going to find one more article. You can search forever, and then all of a sudden your paper's due tomorrow. So don't get caught up in like the searching, because there's always going to be another paper. You have to just say, I am going to finish searching on Wednesday, and that's the end of it. A couple of other handouts. The title of the handouts are kind of self-explanatory. This is a little tip sheet on evaluating articles, and this is a blog post that's just kind of approaches one way to read articles. If you're kind of new to reading articles and writing papers, it can be very handy. I think I'm going to just breeze over some of this other stuff now, looking at the time. Okay, so what I'm going to do, let's move you over here. I'm going to go to this tab that says evaluate what you find. So this is about taking these papers you find and figuring out if it's good. And good means two things. Good means, is it good for me? We kind of talked about this. Does it address my question? Is it relevant? Okay. If no, into the waste bin it goes. If yes, then is it good? Is it a good article? Like, is it good research? I have this clever little image here about point of view. Sometimes the article is going to have a point of view, and you can see how the same thing can have different points of view. So you're imagining a light creating a shadow on this floating object as a graphic way of pointing out that the same thing, the same evidence, can lead to different conclusions. So you want to evaluate the quality of your article that you find. And I have some ideas on here to sort of do that. And bad articles get published, or bad could be too strong a word, but you want to look at, like, what's the agenda here? Is there an agenda? And sometimes the agenda is related to who is paying for the research. So research is very expensive. I can't just like go on my own and say, I'm going to like do a study, and I'm going to get a study group, and I'm going to just pay for everything all by myself. Generally, there's funding, and funding for research generally comes from the government, like NIH, industry, as in private companies, or sometimes like nonprofits or educational institutions. So does who pay for the research matter? Well, maybe it does. Industry-funded research tends to have a conclusion that's more in line with the industry way of thinking. So, if the tobacco industry is funding research on smoking, they're going to find, your research is going to show that, oh, smoking ain't so bad. Now, industry-funded research doesn't necessarily mean it's bad research, but it is worth your while to note that. And in the articles, in the PubMed record itself, and in the actual article, you will see a statement of who has funded the research. Other things to look at, I've got listed here, the whole notion of race and racism. You're going to find a ton of articles that talk about race. But are they really talking about racism? When they talk about a disparity or something like that. There's also the whole notion of funding. And I've got a few things on it here. There's actually been articles that show racial disparity, gender disparity in what gets funded for research. and you kind of never see what never gets researched and published. On the right side here, I've got some things to look at when you're reading an article. You know, a lot of public health research is based on surveys. So if I read an article that says, we did a survey among 15, you know, pregnant women, blah, blah, blah. And I'm like, well, this is lovely and it might be wonderful research, but, you know, 15, I don't know, that seems like kind of a small number. I would be much more excited about your research if you got like 350 people to do the survey, not just 15, because with small sample sizes, the likelihood of introducing bias into the study increases. There's other things on here that I'm not going to read. Reliability and validity, you know, is the survey I'm doing understandable by the people taking the survey? So it's a good idea to make sure that's the case before you, you know, give out 1,000 surveys and do your research based on it. Okay, I'm going to stop share for a second. I just wanted to make sure that all of this, you know, made sense. Any quick questions here in the middle? Okay, it hit me now. I'm going to share again. Where's the button? Here we go. That when we were talking about PubMed, and let me go back. I click back here and click on PubMed, that I didn't talk about how to actually find the articles. So let's go back to our search. And in PubMed, by the way, if I click on this advanced link and scroll down, it has all the searches we've done for this session. So if I go, let's just go back to this search of 240. So let's just click on this lovely article here. So in PubMed, there will often be these icons off to the right. And this is kind of your way, unless you have an institutional like UC Berkeley PubMed, this will be your way to get at the actual article. And especially if you see something that says free full text, then you're pretty much guaranteed you're going to have access to it. I'm going to hit the back button. In PubMed, I can click on this box that says free full text, and it will limit my search result to only those articles that are freely available online, which in this case is about a little more than half of my original search of 240, my original result. So every one of these will have some kind of link like this, or sometimes clicking on the DOI will also work. That will take you to the article itself. Okay, because you do want to read the full article. Let's see, we were talking about evaluating. I wanted to also mention about citations. So you do want to cite the research that you read and put in your papers here. And I have a little bit on why you'd want to do that here on the top middle. Basically, when you're writing a paper, you're joining a conversation. You're joining a conversation about your topic. And you want to acknowledge the people who have spoken to this in the past, just as you would want to be acknowledged for your great work on this topic if in the future someone uses your work. I also have some stuff on here about writing, some places to get writing help. This is a Berkeley site, but they have all kinds of tip sheets and handouts that you don't have to be a Berkeley person to get from this database, you know, simple things like how to construct a paragraph, you know, just that basic stuff if it's been a long time since you've written. You know, just some basic stuff about writing. You know, what am I writing about? Make sure that is very clear right away, like in the title. Does my literature review provide background and identify gaps? Usually when you're writing, or certainly when you're doing research, you want to identify a gap that you intend to fill. And how does your research fit in with the body of knowledge on a topic? And that body of knowledge might be what you're doing when you're writing a review or just a term paper on something. You're, you know, kind of ascertaining what's going on. and do your conclusions follow the evidence? There's this lovely entity called the National Center for Faculty Development and Diversity, which does require institutional access, but some of the stuff on the website is freely available. And they talk about taming your inner critic. So when you write, you're going to be talking, you're going to be dissing yourself, you know, this is terrible, I can't do it, you know. So they have some lovely tips here, and I think they have more on their website, you know, on how to like feed information to yourself that will kind of keep you going on. Oh, I'm wasting on my time. This is nothing new here. No, it is new. I'm approaching it in a new way with a different perspective, a different point of view. So I will keep going. And then what I also wanted to mention here is Zotero. So I don't know if anyone here uses Zotero or some other tool like this, but you really should start using something like this. If you're already using RefWorks or Mendeley or EndNote or something else and you like it, fine. I recommend Zotero because it's free, it's open source. So these programs called reference management or citation management, basically you create a database of citations from all the places you get articles. And you can organize them into folders. So that's very nice, folder for this project or this class or whatever. You can actually bring in the PDF of the actual article, and you can share your database with collaborators. And the very lovely thing is that you can format your citations in Word. Zotero also works with Google Docs. And here's what that might look like. So let's just get rid of exercise. Okay, so let's just say you're writing a term paper and you need to cite something. So in Word, once you get Zotero, you'll get this Zotero tab in Word. So you click Add Citation. So the first thing it's going to ask you to do, and hopefully this will work in the time we have, it's going to ask you what style you want. And they list a few basic ones, but they actually have thousands of styles. So I'll go ahead and pick APA as my citation style. And then you hunt for your citation. Here's the citation I wanted to do. And then you hit enter, and I have cited it. Okay. And by the way, I'm using Zotero. My Zotero database looks like this. Here's all the articles I've added from every place I've searched. And here's like folders that I've made and so forth. Then you can add another sentence and add another citation. Usually what you'll be doing is searching for like an author or an article title. And then if I click add bibliography, in a few seconds, I've got my citation list at the end. So what you just saw, imagine, if you will, that you had a paper with 50 citations in it. And that formatting all the citations like I just did took, what, 5 seconds? And then think of a time when you manually typed, a bibliography with 50 citations. So this is the one reason why I strongly recommend that you get Zotero. It'll do the work for you. No one should ever have to type citations. Okay, I'm going to very quickly, I know we're at time, but I promise to be really fast. I'm going to go back to our web guide, if my computer lets me. Here we go. And just very briefly, I have a little tab that says information about your community, which basically means statistics. Sometimes you're writing something or doing something and it's like, you need to know, oh, how many, whatever type of people, how many, refugees are there in my community? There's places where you can get these kinds of informations. How many people are uninsured in Alameda County or whatever? You need quick information on your community, and here's a few places that are freely available that you can get that information. You are also always welcome to contact me, with that question, like, Michael, you said there was a way I could figure out how many, people who don't have a college degree, live in Houston, Texas or something. Yeah, we can get that for you. It'll take 2 minutes. Okay, so I've talked a lot. I really hope that you've got a few things in your mind that you didn't know an hour ago. And I'll take any questions, comments, something you wish I had talked about more, something I forgot to talk about, something that's completely unclear, anything while I drink.
Yes, thank you so much for sharing. I learned a lot personally. But we did have a question in the chat, and if anyone else has any questions, go ahead and send them in the chat, or feel free to unmute. But Beatrice said, what determines whether an article will be freely available or not?
Oh, yes. So basically, it depends on the journal that the article is in, is part of it. So there are some journals that every article is free. That's just how they do things, and yay for that. There are some journals where if I want to, submit my article to this journal, I can say I want this article to be freely available, and usually the way it is there's a fee I have to pay. So I have to pay, Distinguished Journal, $1,000, and they'll make my article free to the world. So it depends on either the journal is always free, or, when the researcher sent their article to the journal, they paid an extra fee to be free. Now, that being said, if you are affiliated with UC Berkeley or some other institution, generally universities, and by institution, I mean a university or college, generally universities or colleges pay for subscriptions to journals that are way beyond what's available free to the world. So if in that case, if we were using the UC Berkeley, for example, PubMed, there would be a little button next to each article citation that you would click on to get the article. And, we don't subscribe to everything at UC Berkeley, but we subscribe to a lot more than what's available for free. And this would be the case at wherever other institutions that you might be affiliated with.
Perfect. I hope that answers your question, Beatrice. If anyone else does not have a question, I have one. So you mentioned Google Scholar for a quick minute, but that's my primary resource when I'm like researching for MCV or like, but do you have any tips for navigating that resource to make sure you're getting like the best of it?
Sure. So, sorry, let me share real quick. So Google Scholar, which is just scholar.google.com. So, it looks very googly, right? So, the problem with the Google Scholar is that it's really hard to do a search where you get less than a gazillion articles. So if I just do something on, asthma and poverty or something like that, and children. So I want articles that address all these three topics, and click go. So look at this, 114,000. I mean, come on, it's not going to happen. But since Google sorts by relevance according to their algorithm, then hopefully in the first, couple of pages, or however many pages I can stand going through, there's going to be some good articles on my topic. Now they have this date thing here, although I would be very careful, because sometimes I've clicked on like, okay, I want only like recent stuff. So let's click since 2017, or they let you do a custom range. Let's just say 2015, and you don't have to put an end year here. And it seemed to work okay. I don't know, it's hard to say, but sometimes I've done a year thing and like all of a sudden there's like 20 articles and I'm like, wait, what just happened? It's like, I don't know. no one knows how Google works because it's a secret. They don't tell you how it works. But meanwhile, it's like, okay, here's recent research on my topic, asthma and poverty in children. So the one nice thing about Google Scholar is that it generally links to a publisher's website. So I'm going to click on this one, the first one. And so you'll know right away if the article is freely available or not, because here this one says full article. And so I got the article. Yay, I can read this article. If you see a thing that says you don't have access, pay us $35 for this article, well, then hopefully you are at an institution that has access, like Berkeley or whatever. And remember, I talked about cited references. So that's what this is. So this 2017 article, there's 41, more or less, articles newer than it that cite it. Some of these numbers are really big. 150, that's pretty big for an article that's 7 years old. And if I click on this, it'll take me to that 151. Now, even Google is smart enough to know that it's an approximation. There might be duplications in here and so forth. So that's like, if I liked this article, there might be some here in this list that I also want to take a look at. And Google Scholar, you can use the quotes for a phrase. You can do, let me go back to my actual search. You can do things like nested Boolean statements, they're called, where you do like, okay, the article can mention poverty or it can mention income, either one of these, as well as asthma and children. So that, of course, makes it grow because I'm adding more terms. If you want it to be smaller, you could do something that's going to narrow your search, like maybe a geographic term. That didn't help a ton. Keeping in mind that this could be a word in like the author's address and not really about the article. So hopefully that helped a little bit.
Yeah, thank you. That helped a lot. Sorry to interrupt. We're at the 2-minute mark. So we have time for one more question, but I'm going to launch a poll. And if you could please take some time to answer it, it really allows us to gauge our audience and how helpful the seminar was. So I'll go ahead and launch that, and it is anonymous, so please take some time to vote on it. But if we have time for one more question, if anyone has one.
Well, I really appreciate that you took an hour out of your, like I said, infinite busy time, which of course means we all have none, to sit with me in my house. And I hope you all have lovely rest of your afternoons and good weekends. And you're welcome to contact me. I'll go ahead and put my email in the chat. For anything like this, let me make sure I'm spelling Berkeley right, which I still don't know how to do. Oh, whoops, I think I sent it to just, let's try that again.
Yeah, thank you so much, Michael, for taking time out of your busy schedule to come talk with us.
Sure, it was a pleasure.
Yeah, especially for folks that aren't really into research just yet, it's really helpful knowing this information. So yeah, please take the time to fill out the poll. Thank you to anyone else that already has, and you may leave. Thank you so much for coming to this seminar.
Thanks. See you later.
Bye, Michael. Thank you.
Thank you.
Thank you.
Thank you.
Okay. Thank you all so much.